everybody, and welcome back to Diabetes Eating and Wellness. We're doing the do here as part of our education session for diabetes education. We've got being active. Today, Julie Nance is talking all about fitness. So you'll remember she's a registered dietitian, nutritionist, certified diabetes care and education specialist, as am I, but I'm thankful for her leadership for this education session. So take it away, Julie. Let's hear about fitness today.
Okay, we're talking about being active. So quick raising of hands. I know I can't see you. Who's active? All right. So yeah, some of us are and some of us aren't. Some may be active a little bit and some a little bit more than others. So we're going to talk about the importance of exercise, some different points as far as diabetes and exercise that are kind of important for you. So insulin does help, or exercise does help insulin work better in the body. Actually, an exercise muscle uses insulin more efficiently. So that's kind of nice to know, right? Especially if you have insulin resistance or maybe you're on medication that can help the insulin to work a little bit better in the body. That exercise muscle, that lean muscle mass that comes from an exercise muscle will help the insulin to work a little bit better in the body. Physical activity does strengthen the heart, especially if it's those cardio type of exercises. Not everybody can do those. So we are going to talk about the importance of also meeting with your doctor prior to doing any exercise, especially if you haven't done anything in the past. It does decrease the risk for heart disease. It decreases cholesterol. And actually, it does help to raise HDL, your good cholesterol. It helps to raise HDL cholesterol. You want that number a little bit higher. And it helps to lower the LDL cholesterol, that bad cholesterol. So exercise is looking like it's pretty doggone good. Now, it also helps to lower blood pressure. One of the things that my husband, when he was stationed in Afghanistan and Iraq back in around 2007, his blood pressure went up after being in Afghanistan and Iraq, and he started having to exercise when he came home so that he would lower his blood pressure. Never had to go on medication for it because he was exercising routinely, and that helped out a whole lot. So improves mood. There's another one. It creates endorphins. So you've heard that, I'm sure, and it helps to increase and improve mood. How many of you have exercised? Okay, yeah, maybe tired afterwards, but how many of you have exercised and you just felt better? You just appreciated that period of time exercising because really you didn't want to do it, but once you did it, you just felt better. And it does improve mood. I always say it's one of the least expensive counseling and therapy treatments that you can get. Just go for a walk and it helps to improve the mood. Lower stress and anxiety, that ties into, helps to improve mood. It does help to release that stress. It can lower the heart rate and increase the heart rate, but lower blood pressure, which can actually help out with that anxiety and stress. Improves balance. So as we age, we tend to lose some balance, right? We aren't as stable as we used to. Certain types of exercise can certainly help to maintain that balance. It builds the muscles up in the core to help strengthen the core so that balance is something that you really, a lot of times, don't have to think about too much, especially as we age. And it lowers the risk for osteoporosis. So exercising or weight-bearing exercises like walking, even just as simple as walking, actually helps to build bone mass. So that increases that bone mass and decreases the risk for osteoporosis. There are other things that come into play like calcium and vitamin D, yes, but exercise does help to build bone mass. So it is important.
All right, thanks for that, Julie. Now let's talk a little bit about exercising safely. One of the most important things that we can do when we embark on anything new is to make sure, hey, we're safe. It's a good idea to include your healthcare provider to help make sure that they're in the loop with the plan. Sometimes there are some medications, health concerns, or injuries that might make physical activity risky for some people. don't worry, most of us are going to be fine. So we're going to get to it. Let's get that mindset on our heads, that yes, we're probably going to be fine. So just double check if you have concerns. We do want to make sure that everybody's aware if you have any health concerns. To also help build that awareness, please see your self-assessment sheet. It makes sense to give this a little bit of time to focus in and take your own self-inventory or self-assessment about all the creaky spots. You know, what we want to identify is if there's any injuries that might be looming that don't have to be there. It is wise to explain that to your diabetic educator, your healthcare provider, or anyone else on your team, so that we can make sure that we don't take 2 steps forward and 1 step back, because we want you to continue to soar once you really get this physical activity piece up and away. So fill out that self-assessment sheet and just make note of any areas where you might have a lingering sore spot. Okay, we want to know. We might talk to you about developing a team of support. And sometimes we're talking about something as simple as the right physical therapist. Many of us have been to a physical therapist, and they, within their own discipline, have different specialties. So making sure you get to the right one for your particular injury is really important. Also, being open to maybe performing some self-massage. Certainly something like a tennis ball into the shoulder might be just what the doctor ordered. Other folks, keeping a rolling pin in the sofa so we can really roll out a sore muscle. So, be open to opportunities like that to perform some self-healing, but also might look at things like aromatherapy and acupuncture and other things that might just be the most appropriate tool to get out of pain, so that physical activity can be for you too. Self-monitoring always helps though. So as you are embarking on this physical activity journey, please just jot down anything that didn't go well. Did you feel tightness of the chest? Did you feel a little dizzy? Did you feel like, gosh, that foot was really starting to hurt? We want to know these things so we again can help you soar. Okay, so keep in touch with us, and let's share those documents as you have them.
So Caroline, I used to hear often no pain, no gain. Does that still stand true?
I love this, Julie. Yeah, we've all heard the no pain, no gain. And I think it works pretty well for the teenage athlete who's really learning to exert themselves for the first time. But for the rest of us, pain is there for a reason. And exertion, or that good pain, is different than bad pain, which might be that creaky shoulder starting to act up. We don't want to continue exacerbating that pain or that injury. Or it could be that knee. We don't want to work through that pain. So don't feel like you have to be super tough, that you have to push through these things, because sometimes that can leave you on the bench for a long time. And we want to continue to see that upward positive momentum going for you as we start. So recognize exertion is different than pain. Okay, so we just want to strike that right balance.
Yeah, and sometimes pain can keep you from moving on, and it may make you want to stop. You know what? If this is just going to hurt, I'm just not going to do it.
Yeah.
So we want to make sure that the pain is taken care of first before you continue to exercise.
Awesome.
Okay. So now moving on to what counts as exercise. It really depends on the individual. Depends on their past history with exercising. Have they been exercising recently? Are they able to physically exercise? Are they medically able to exercise? What about medications that they're on? So there's a lot of different things that can play into what counts as exercise for individuals, and it is individualized, just like the medication, and sometimes and a lot of times like the food that we eat, it is individualized. So yard work for somebody who may not be very active, yard work can actually be a good type of physical activity as long as it is for a period of time. Now, right now, I got out in the yard this past weekend, and with the 99-degree weather, didn't stay in the yard more than 5 minutes. Came back inside and went, nope, not today. So, it's hard to stay out there in this kind of weather. But yet I was able to exercise later on in the day. Once the sun started going down around 7 o'clock, I was actually able to do a little exercise after that. So I replaced that yard work with something else, with walking later on in the day, which was a big help. Now, playing with children or grandchildren, now we all know that is a big workout, especially when you have to pick them up and put them down. Do again, do again. So that's a lot of up and down. Well, that's a pretty good weight that you're lifting and lowering often throughout the day. So yeah, it can count. It certainly can. But if there's any opportunity that you can take to even just add some extra steps in your day, take the stairs instead of the elevator if it's possible for you. That's a great way to get some extra steps in the day. When I worked at the hospital, in my 8 to 10 hour day where I worked at the hospital, I used to track my steps. I never took the elevator. I only took the stairs, and my office was on the 4th floor. So that meant I had to climb up 4 flights at least, 6 or 7 times a day. So with that, up and down, I would actually track around 8 miles per day in steps that I would take. So that's a lot of steps, and that's a lot of moving around. So you can add in a lot of steps and some good exertion in those steps up and down. Or even if you have time during lunch, if you are allowed some extra time during lunch, where you could go outside and walk around in your parking lot. 10 minutes, or walk around on the inside. Last year, the end of last year, in the fall of last year, I was going through chemo, and hence the hair. And with the chemo, I knew I needed the exercise, but because of the fatigue, I didn't want to have to leave the house and come back. It was too difficult. So what I would do is I created a pathway in my house, and I would walk through every single bedroom, through the entire house, up to the bonus room and down, and I would do it multiple times throughout the day to get in some steps as much as I could. And actually that exercise helped to get through some of the chemo a little bit better. So there's a lot of different things that you can do. Standing up while you're watching TV, and maybe marching in place, or taking steps, or knee lifts if that's possible. If you have weights, lifting some weights. Carefully, please, but lifting some weights. Again, a lot of this stuff is going to depend on what your doctor says is going to be best for you. So as far as fueling means getting the food in to get you through that workout. And a lot of it is going to depend on the medications that you take, or the type of exercise you're going to do, or how long you're going to do that exercise. If you're going to go walk for 30 minutes, you should be fine, especially if your meal was 30 minutes or an hour prior to. Then you should be fine. Again, it's going to depend on the medication that you take. You are going to want to test the blood sugar, prick a finger before going to exercise, so that you know what your blood sugar is. There is a risk that exercise can actually cause the blood sugars to drop. So we want to make sure that it is good prior to starting that exercise, so that you can stay as safe during your exercise. We'll talk more about that when we go into self-monitoring. So moderate, again, it's going to depend on the type of exercise and what you perceive as a moderate type of exercise. This is the rate of perceived exertion, and what you consider as moderate or heavy or very heavy really is going to depend on the individual and how much exercise they've done in the past, or what they're able to do, what they have the endurance or stamina to do. So if you are, I did it again. If you are at a moderate level, you may need something, but if that moderate level of walking is, let's say, 3 miles per hour walk, which is a fairly decent pace at walking, then you may not need anything at all. You may not need something every 15 minutes, but again, it's going to depend on the medications that you're on and what your blood sugar levels were prior to. Now, post-workout, do you need to eat something after your workout? That again is going to depend on what your blood sugar levels are and how you feel afterwards. If you ate lunch, but at 2 o'clock you're going to exercise, and then you're going to eat dinner afterwards, when that dinner will be your post-exercise meal. And you don't have to worry about eating a snack if you're going to eat dinner fairly soon. Not necessary. But you may have to eat something depending on what your exercise was, how long you exercised. I don't personally like to eat after I exercise. I don't feel very good if I eat something. And did I need to eat something after I've exercised? You know, do I need it? Is it necessary? And many times it's not necessary, depending on how long the exercise is. My husband, who was a triathlete, now he would practice. That's somebody who it's a swim, bike, run, all in the same event. For somebody who does that, can be up to 4 hours. He's going to need something during. It's very high intensity exercise. He's going to need something before, during, and after. But most of us who are just doing 30 to maybe 45 minutes of exercise may not need something. So you're going to get this handout one more time. You'll see it again.
Oh, well, I'm excited to put this into practice, Julie. We're going to take this video to the gym. Okay, so we're going to see you on the next video for self-monitoring, and we can't wait. Thanks so much, Julie.